All right, so it's 10 a.m. and we have our session scheduled for now, so we'll go ahead and get started. First and foremost, good morning to all of you joining us today. Thank you so much for taking the time to come and join us to talk about something really exciting, which would be your retirement on behalf of Alberta Blue Cross. ARTA and the Health Benefits Trust of Alberta. We welcome you to our retirement benefits information session this morning. So just a disclosure before we go ahead and get started, you may have noticed that the session's being recorded currently. So it is going to be recorded and posted on ARTA's YouTube channel. So you'll notice that your video and microphone have been disabled. And really that's just for your privacy. We will be going through a lot of information today, and I'm sure there will be some questions along the way. Certainly, if you have questions, we really encourage you to use that Q&A function in Zoom so we can make sure we answer your questions, and really refrain from using that chat box because we may miss some of those questions. And really, as we go through today, we have our team members here to assist us in answering all the questions there. In terms of what's on the docket, this is what we'll be reviewing today. We're going to start off by reviewing the different programs available to you here in Alberta, the different government-sponsored programs. Then Alberta Blue Cross will go through the retiree offering there, and then we'll pass things over to Jennifer to speak to the ARTA options as well. So I'll introduce myself before we go any further. My name is Caitlin. I'm also joined by Candice. We both come from Alberta Blue Cross. We also have Jennifer, Amanda, and Rosie here from ARTA, and they'll be reviewing those ARTA health benefit plans and answering those questions of all things ARTA. So let's level set today's conversation. Just wanted to get to know you, the audience, a little bit better. This is something called a Mentimeter, so feel free to use your mobile device to scan the QR code. There is that website menti.com, and you can use that code that's on the screen. The first question I'd like to ask you this morning is, when do you plan to retire? Is it going to be 1 to 2 years, 3 to 5 years? More than 5 years, or are some of you in the audience already retired? Feel free to put your selections in now. Okay, some answers are coming in. Majority of you are quite close to your retirement, 1 to 2 years. Some of you are already retired. I'm in that category of more than 5 years. So I'll join those 3 individuals there. Awesome. Okay, so you can keep that Mentimeter open. The next question I'd like to ask this group is, what do you look forward to in retirement? Is it travel? Is it hobbies, time with family, relaxing, volunteering, socializing, or focusing on your health? Feel free to put your selections in now, and I believe you can choose up to 3, so go ahead. Okay. So the responses are coming in. See a lot of you looking forward to traveling. So you are supposed to have more time to travel in your retirement. So that's great. Really close to travel is time with family. Perhaps you're going to travel while spending time with family. Then there's focusing on your health right behind them, and hobbies, then relaxing and socializing, and then volunteering as well. So sounds like you guys want to do it all in your retirement, especially traveling and spending time with your family. And rest assured, we will be reviewing the travel components to these benefit plans in today's session. All right. The third question I'd like to ask is, what concerns you the most in your retirement? Is it finances? Is it travel, health, benefit coverage, government assistance, life insurance, or pension benefits. Feel free to put your selections in now. Okay. Sounds like finances and benefit coverage are really top of mind in terms of what concerns you the most in your retirement. And really, those go hand in hand. So hopefully we can help with that concern today and give you some peace of mind and really help you plan for your finances as well. All right, so we're going to go back to those presentation slides, review some of those things I mentioned we would go through today, and we're going to start off with the Alberta Blue Cross portion. So just wanted to give you some background on Alberta Blue Cross as an organization. So, some of you may know, we are a not-for-profit organization that has been in the industry for over 75 years. We are an Alberta-based, Alberta-grown organization that creates health and dental benefit plans for Albertans by Albertans. And within that 75 years in the health insurance industry, we've helped onboard 1.8 million members. And that would also include over 30,000 members on the retiree plan we're going to be discussing today. But before we discuss the retiree plan, wanted to review the different government-sponsored programs that are available to you here in Alberta. So there's going to be three that we're going to review with you here. If we go to the next couple of slides, you'll see that we have three different things we want to review. So the first being that Alberta Healthcare Insurance Plan that you'll see on the very left-hand side. So I'm sure many of you are familiar with this one since it is available to all Albertans at no cost. But what's actually covered on that Alberta Healthcare Insurance Plan? Well, for one, it covers physician visits. It will cover hospital procedures and standard ward hospital accommodations. Now, if you're looking for more coverage than that, that's when we start speaking to the two other government-sponsored programs you see on the screen that Alberta Blue Cross does help administer. So the one right in the middle is something called the non-group plan. This non-group plan is for individuals under the age of 65, and there is a premium associated with this non-group plan. It's $63.50 for a single individual and $118 for a couple or family. And what's covered under the non-group plan will be 70% coverage on any eligible prescription drugs, 100% coverage on ambulance, diabetic supplies for insulin-treated diabetics, as well as psychological services. And in terms of those 70% coverage on the eligible prescription drugs, you don't pay more than $25 from your pocket for this non-group plan. Now, once you turn 65 here in Alberta, you then get access to something called the Coverage for Seniors Plan. This Coverage for Seniors Plan, again, is for individuals 65 years of age and older, and it is premium free. So there is no cost associated with a Coverage for Seniors Plan. Now, what's actually covered in terms of benefits for the Coverage for Seniors Plan will be 70% coverage on any eligible prescription drugs where you pay no more than $25 from your pocket. It'll cover 100% ambulance, psychological and chiropractic services, as well as diabetic supplies for insulin-treated diabetics. So for some individuals, the coverage I just described would be enough for them, which is great. That's why these different government-sponsored programs are available to us here in Alberta. However, if you're looking for something more comprehensive, something that may cover things like paramedicals or vision or dental, something that might be more similar to what you're used to on your employer-sponsored benefit plan, that's when we start speaking to the different personal benefit options available to you, which would include our retiree plan here at Alberta Blue Cross. So now we're going to spend the bulk of the Alberta Blue Cross portion on this retiree plan and really to give some background on this plan. It was launched back in 2017 when we heard that there was a gap in the marketplace in terms of what retirees were looking for from a benefit perspective. So based on focus groups and surveys, conversations with those retiring and retired, the retiree plan was born. And since 2017 until now, like I mentioned earlier, we've onboarded over 30,000 members onto this retiree plan. And along the way, we've made some enhancements based on some additional feedback. So happy to share those with you today. And we're going to start off with the plan features. So in terms of the plan features, the first one on there is immediate access. What this means is you get immediate access to all the benefits on our plan. You do not have to serve any waiting periods, and you do not have to go through a medical review. So you don't have to answer any medical questions. Now, based on our plan designs on all our personal benefit plans, including the retiree plan, we do offer flexible solutions. What this really means is you're able to pick and choose your levels of coverage based on your needs. And with that is the ability to upgrade your levels of coverage at any time. So we'll review this in a little bit more depth in a couple slides. Now, another feature is national coverage. So once you've enrolled onto this plan here in Alberta, you're able to take the retiree plan with you wherever you decide to retire and reside across the country. So whether you're going to go on the East Coast to spend time with your family, it sounds like a lot of you would like to do that, or go on the West Coast for better weather, certainly you can take the retiree plan with you. Just keep in mind the rates will be dependent on the province or territory you decide to reside. As some of you may have experienced on your current Alberta Blue Cross plan, we do have a focus on wellness here at Alberta Blue Cross, and that doesn't stop as you get into your retirement. So there's a suite of different wellness tools available to you into the retiree plan. Now, it sounded like a lot of you are looking forward to traveling in your retirement. So rest assured, we do have worry-free travel embedded in this plan, and that will offer an unlimited number of trips per year on this plan. Now, I skipped that link plan. So a very common scenario we've seen for individuals is they'll retire and then decide they want to return back to work. So certainly, we've seen that many times, and so we have a link plan available, and this link plan allows you to place your retiree plan on hold and any accompanying discounts. So that's something that's a really great feature to this retiree plan. And all this to say that we offer that confidence and security from a brand you already know and trust. So who can actually apply for the retiree plan? Well, in some ways, this retiree plan is quite exclusive because you must fulfill this eligibility criteria. First, you must be at least 50 years of age at the time of application and coming off an employer-sponsored benefit plan like you are currently. The main thing I'd like to highlight here is you must apply within 90 days of your employer benefits ending. So you guys are doing great already. Many of you are 1 to 2 years out from your retirement or more, so you can plan ahead. Just please keep in mind you have a 90-day window to get all your ducks in a row and enroll onto this retiree plan. Once that 90 days has lapsed, the retiree plan will no longer be an option. So just keep that 90-day window in mind. Certainly what we've seen is individuals will get this in place in advance of their retirement just to maintain that continuous coverage because we will start the retiree plan the day following when you've lost your employer-sponsored benefits. And last but not least, you must have Alberta provincial health care. Now, before we get into the next slide, what does that flexible solution piece mean? I'll just remind everybody if they could put any of their questions in the Q&A function at the bottom, just to allow us to ensure that we answer all the questions and we answer them in a timely manner. All right. What does that flexible solution piece mean? As you see on your screen, there's going to be 3 different categories on the left-hand side: prescription drugs, optional dental, and extended health benefits. Across the top, you'll see actually 4 different levels. We recently added this level D, but you'll see level A, B, C, and D. Level A is going to be the most basic level, and level D is going to be the most comprehensive. What you'll notice is there's check marks under each level, or different levels for each of the categories, really showcasing that you can customize a plan that's the right fit for you. I'll remind you, you can upgrade your levels of coverage at any time, but please keep in mind there is a 24-month waiting period to downgrade levels of coverage, and that's really just to maintain the affordability of the retiree plan. Now, we're going to get into each of these categories in a little bit more depth, starting with the prescription drugs. So again, you'll see level A, B, C, and D, where level A is going to be the most basic, starting at 70% coverage with an annual maximum of $1,000, and this is per participant on the plan. You'll notice the coverage increases as well as the annual maximums all the way to level D, which will offer 90% coverage with an annual maximum of $5,000. Now, I'll remind you again, you get immediate access to all the benefits, and there is no medical review. This is a guaranteed acceptance plan, meaning we don't take a look at pre-existing conditions or pre-existing medications. Another perk or feature of this prescription coverage is we offer that direct billing. So however you may bill or direct bill now, that is going to transition with you onto the retiree plan. I'll also remind you of those government-sponsored programs we spoke to at the very beginning. If you remember, those covered 70% of your eligible prescription drugs where you paid no more than $25 from your pocket. So in the instance that you have a prescription drug that's covered on both, then the plans will coordinate and you'll get as much coverage as possible on the prescription drug. Or if it's not covered by that government-sponsored program, it may very well be covered on this retiree plan, since the retiree plan does cover over 9,000 different prescription drugs. Now we're going to go into the second category, which is our optional dental. And this is something also we've enhanced. So the dental portion is now optional here on our retiree plan. This is in alignment with some things you may have heard about that federal dental program, as well as what we've heard that some individuals would like to have this benefit or category optional. So we heard the individuals and now it is optional, again, offering A, B, C, or D, where A is going to be the most basic, covering 70% of your basic dental, which would include checkups, cleanings, fillings, extractions, and root canals, offering a $750 combined maximum. Level B will now increase in terms of the coverage for basic dental and the combined maximum, and now offer coverage for dentures and periodontics. Level C, again, an increase in the combined maximum and the coverage for the basic dental, an increase in the periodontic coverage. And then now extensive dental is getting introduced at 50%, which would offer crowns, bridges, and implants. And the most comprehensive level, level D, offers 90% coverage on the basic dental, 60% coverage on dentures, 90% coverage on periodontics, 60% coverage on extensive dental, all for a combined maximum of $5,000. Again, all the maximums that you see here are per participant on the plan. All right. The third and final category that we have on our retiree plan is our extended health benefits. And these extended health benefits, there's a long list of different things that would fall under this category. These are some of the highlights. So psychology, home nursing, acupuncture, homeopath, osteopath, naturopath. There's vision under extended health benefits, hearing aids, foot orthotics, those paramedicals like chiro, physio, and massage therapy. There's wheelchairs and hospital beds, accidental death and dismemberment, and of course, there's travel. So travel coverage is embedded in that extended health benefit category. And we're going to spend some time on the travel coverage because it sounds like this is something that's important to many of you today in today's discussion. So for travel coverage, the level that you choose for extended health will follow suit with your travel. So it will offer again level A, B, C, or D. So if we see on the screen, that will offer 30, 60, 90, or up to 120 days per trip. And this is something that we heard people were looking for, especially those who were snowboarding during their retirement. So up to 120 days of travel per trip. And we offer this 5 million per trip maximum, something that is also important to us because we have paid out claims in the millions here at Alberta Blue Cross. And what you'll notice and you'll see is that every time you return back to your province of residence, that 5 million will get reset. There is a 90-day stability clause here on our retiree plan. And really what that means is if you have a condition, it must be stable for 90 days for it to be covered while you're away. And this stability clause is in place for two reasons. The first being we want to make sure that you're healthy and able to enjoy your experience while you're traveling. And second, we want to make sure that we can cover the claim if something does arise while you're away. We certainly will cover pre-existing conditions on this plan. We just ask that they're stable for 90 days, that you have no change in medication or any outstanding tests or surgeries upcoming within that 90-day period. We also have added flight delay service, and we'll review that in the next slide, something we're really excited about. But we also offer different travel discounts with the retiree plan. So the first one there, 15, 20, 25 for level A, B, C, or D for any travel extensions that you may require on your trip. So let's say you've chosen level B because majority of your trips are 60 days, but you have that one trip upcoming that's going to be 70. You can actually reach out to our travel department for that extension of the 10 days and have that travel plan discount applied. We also offer trip cancellation insurance here at Alberta Blue Cross. So this is something that's available to you now currently, and currently with a 10% discount. And that also continues with you as you transition onto the retiree plan. Now, what is that flight delay service? So really exciting addition to our retiree plan. So this flight delay service offers you access to an airport lounge if you have a delay that's 3 hours or more, or the cash equivalent. Now, if you're delayed 6 hours or more, you now get access to a hotel room and a $50 per person allowance. Now, if a hotel room is unavailable, you'll get compensated up to $250. So I know since COVID, there have been quite a few delays at the airport. So we just felt like this was a great addition, not having to wait to see whether the airline will compensate you, the airport. So this is just really something easy for you to access. An application that you put your flight details in, and that application will actually watch for any delays that you may be having. Next, we just wanted to share a travel claim that we've seen come through here at Alberta Blue Cross and why that 5 million is so important, that per trip maximum. So an example we've seen is Peter, age 66, level B on extended health benefits, meaning they'd have 60 days of travel coverage. Peter traveled to Hawaii, scraped his knee on some coral while snorkeling. That resulted in serious bacterial infection and ultimately septic shock, with hospitalization, physician services, meals and accommodation, and getting air ambulated back to Alberta. That was a total of $761,000 for 22 days of care. So just wanted to share that with you. Not an uncommon story that we've seen. So now we just wanted to share the importance of travel coverage with you. And it sounds like many of you understand that, since a lot of you are looking forward to traveling as well. Now, that suite of wellness tools I talked about at the very beginning, just wanted to show a couple with you. So on the level D of extended health benefits, you'll see access to virtual care. We also have ICBT offerings on the psychology coverage on all levels. We have health navigation, which is a really useful tool on our website that offers different information from vetted sources. Balance, some of you may have used this already. This allows you to manage and maintain your health online. And while doing that, actually get points and bid for different rewards like gift cards. We also have something called the Individual Assistance Program. If any of you have used something called EFAP, it's very similar. These are 12 additional sessions of counseling per year, per participant on the plan. And this can include things like pre-retirement planning, even things like grief and bereavement. So there's a lot of different tools under this individual assistance program that you get access to outside of all the benefits you already can utilize. And last but not least, Blue Advantage. This is our discount program here at Alberta Blue Cross. This is something you guys actually have access to already now, but you remain your access as you come onto the retiree plan. And there's quite a long list of different organizations, companies that will give you a discount for being an Alberta Blue Cross member, all the way from things like optical, like Heme Optical, and include things even like HelloFresh. So really exciting wellness solutions that you get access to in your retirement. And these are the different ones that you see on the screen. So why choose Alberta Blue Cross? Well, for one, it is a really easy transition, not just because you get immediate access, but you can actually call and go through the entire process over the phone with one of our benefit consultants, or do it online end to end and get your ID cards in real time. We have industry-leading benefits, as you have experienced. It's continued coverage from a brand you know and trust. So the way that you use our member app now, or member services, the way you submit your claims, all those types of processes also transition with you. And of course, because HBTA has partnered with Alberta Blue Cross, you do receive preferred pricing and a 10% discount on our retiree plan premiums. And that is a lifetime 10% discount. So for as long as you're on the plan, you will receive those savings. Now, what does the cost look like for a retiree plan? So many of you are concerned about the finances. So here's an example of a couple, Karen and Richard, age 62 and 60. Their selections are shown there. Level C for prescription, level B for extended health benefits, so that means 60 days of travel coverage, and level A for dental. You'll see that the public pricing would be $417 a month, but with that 10% discount, it's about $375 a month, which means up to over $500 a year in savings. Now, another example of what this would look like is David, age 65. His coverage selections listed there: level A for prescription. He's 65. He has that government sponsored program coverage for seniors. Level C for extended health, and level C for dental. That's $191.43 for public pricing per month. But with his preferred pricing, it's $172.29. Meaning over $220 per year in savings. So that gives you a little bit of an idea of what the cost can look like. The cost will be based on two things. First, it's going to be based on the individual's age. And secondly, the different selections of coverage that you choose. So please keep that in mind. Certainly, if you have questions about your own personal scenarios or you'd like to get a quote, I certainly recommend reaching out to our benefit consultants or going online and going end-to-end directly. It's really simple and easy to use on there. Now, how can you get support in this plan? Like I mentioned, for the first thing is connecting with an Alberta Blue Cross personal benefits consultant. They really are the experts in this. We have a team of over 30 individuals ready to assist you to answer all the questions, go end to end in the enrollment process. And once you've been already enrolled, you have that one point of contact for as long as you're on the plan. Or you can actually go online if you know exactly what you're looking for and certainly go end to end. Just scan that QR code or go to ab.bluecross.ca/retiree and you can actually go through that entire process, get a quote, enroll online end to end. Now, I'd like to just review with you some key considerations before I pass things off to Jennifer, as you do your research on what benefit plan's going to take you through your retirement journey. So the first thing is eligibility criteria. Does the plan have eligibility criteria? If so, what is it? For us here at Alberta Blue Cross, you must be age 50 and leaving a benefit plan behind and applying within that 90-day window. So just make sure that you keep in mind that 90-day window. The second would be, what are your benefit needs? I always suggest here is to go review your claims history. That will give you an idea of what benefits are most utilized, most important to you, and the maximums you'll be needing. And for our plan here at Alberta Blue Cross, you do have that customizable approach to our plan. So hopefully that will assist in that. The third is travel coverage. Again, many of you are looking forward to traveling. So really take a look at the number of days, understand what the 90-day stability clause will mean for you, that trip maximum, that per trip maximum, certainly review that as well. I always say in all of these sessions, don't leave any questions unanswered. So certainly use us here as a resource, put all your questions in that Q&A, connect with our benefit consultants for a consultation. Our website is a great resource as well. So certainly don't leave any questions unanswered so you can make the most informed decision. And last but not least is cost. Take a look at what the cost will look like now, what it might look like down the road. Take a look at what those savings might mean for you, because this will all help in making your decision. So with that, really appreciate your time listening to the Alberta Blue Cross portion. I'm going to hand things over now to Jennifer, who will review those options with ARTA.
Thank you, Caitlin. Yeah, as mentioned, my name is Jennifer Hope and I'm the Manager of Marketing and Promotions at ARTA. And today I'm going to talk to you a little bit about ARTA and I'm going to do a deep dive into the ARTA benefit plans. Just a reminder, if you guys have any questions, we also have Amanda Shaw here and Rosie who are with ARTA and they'll answer any questions that come into the Q&A function. So just a little bit about ARTA. ARTA was founded in 1963 as a provincial association for retired teachers by retired teachers.
Jen, can I interrupt you?
Oh, yeah.
You're sharing both your screen and the next slide and your notes.
Oh, shoot. Okay, sorry. Thank you. How's that? Better? Better? Okay, thank you. Okay, where was I? Okay, ARTA has expanded to include similar groups such as the people in this webinar. These groups hold the same type of claims risk as a retired teacher would. So having more people on the plan and spreading out the risk, it benefits everybody. So as HBTA members, you guys are part of our public sector. So you might be confused seeing retired teacher in the ARTA logo everywhere, but again, you guys are eligible to join the ARTA Benefits Plan. We have been the sponsor of our group benefit plan since 1995. We also self-administer our benefits plan, so everything is done under one roof. We have over 31,000 members and we cover over 46,000 lives. Our provincial office is located in Edmonton. So if you are in Edmonton, you are more than welcome to come visit us at our office and meet with one of our member services team members. And they can sit down with you and sort of talk about which benefit plan might work best for you and your family. We also have a satellite office located in Calgary. So if you are in Calgary, you can go visit our member services team members there. However, you're also able to make virtual appointments. So if you visit arta.net, you can schedule a virtual appointment and meet with one of our team members online. So there is an annual membership fee to becoming an ARTA member. As a public member, it is $50 a year, and that's $4.17 added onto your monthly premiums if you take part in one of our benefit plans. But with that membership, not only are you gaining access to our benefit plan, we also have some really great membership advantages. We have a really great member discount program called ARTA Perks. We recently brought our member discount program in-house and we contacted hundreds of different partners to give our members discounts, and our members receive some really great discounts at different hotels, restaurants, gyms, airport parking, different attractions. So if you use your member discount program card, once or twice, your ARTA membership will have paid for itself. We also offer scholarships to our members, direct relatives, so any children, grandchildren, nieces or nephews of our members, they're eligible to apply to one of our scholarships and they may be awarded some scholarship money for some post-secondary education. So now I'm going to dive right into our ARTA benefits. So the ARTA Benefits Plan was established in 1995 by a group of retired teachers who wanted to create a benefits plan that was more conducive to a retiree's lifestyle. We all know that retirees are excited to get traveling. You're no longer bounded by vacation time or what times in the year that you can travel. You can travel whenever you want to wherever you want. So the ARTA benefit plans offers some really great competitive emergency travel coverage, as we do not have any stability clauses built into our emergency travel coverage. Also, ARTA is a not-for-profit organization, so any dollar that comes into ARTA goes back to paying out claims, back to the benefits plan, and ensuring we're offering the best benefits to our members. We don't offer that discount. We don't have any of those profit margins built into our premiums. So again, we're a not-for-profit organization ensuring that we are taking care of our members all the time. So there are some eligibility requirements that you need to meet before becoming an ARTA member. So if you're vested to receive a pension plan, so LAPP, PSPP, MEPP, you're eligible to join ARTA. There's no age restriction to joining ARTA. You can join ARTA at any age. If you're one of the lucky ones that can retire at the age of 45, you can join ARTA. And we also don't have any termination ages. You can stay on the ARTA plan, even with our emergency travel coverage, until as long as you need. The last I checked, we had an ARTA member who was 103 years old, and they were still receiving ARTA benefits. Also, your eligible dependents can join ARTA. So if you're eligible to join ARTA today and if something were to happen to you, your surviving spouse is also able to join ARTA. And if you join ARTA as the primary cardholder and something were to happen to you, your surviving spouse can continue on with their ARTA benefits. Also, you must be a Canadian resident covered by your provincial or territorial health insurance within your province of residence. And, you know, also if you have your ARTA benefits and you decide that you want to move to BC and have some, you know, warmer weather, you can do that. The ARTA benefits plan will follow you. We have members throughout the country. The only province where the ARTA benefits do not work is in Quebec, as their provincial health plan doesn't work in tandem with the ARTA benefit plan. So applying to ARTA. Applying to ARTA is really easy. If you know that you are retiring soon, you know, do your research on which benefits plan you want to take in your retirement. And once you decide that you want to join ARTA, I typically suggest to people apply within 4 to 6 weeks before losing your current employer-sponsored coverage. It's really easy to do. You can do it online. It's something that you can check off your to-do list for retirement and get it in early. Or maybe your spouse is continuing to work, you can join their benefits plan while they're still working, while you're retired. So join your spouse's employer-sponsored benefits, take advantage to their employer paying for your benefits. But once your spouse loses those employer-sponsored benefits, you know, get your application in about 4 to 6 weeks early. However, it is really important to apply within 60 days of losing your employer-sponsored coverage. Because if you would like to join one of our plans that include emergency travel coverage, and you apply outside of that 60-day window of losing your group coverage, you would need to fill out a medical questionnaire. And that medical questionnaire is administered by our emergency travel insurance partner, Beneva, and depending on your health, you may or may not be accepted. However, if you want to join a plan that does not have emergency travel coverage, you can join outside that 60-day window without having to fill out a medical questionnaire. And your ARTA coverage starts on the first day following termination of your prior group coverage. There's no waiting periods. We want to make sure our members are covered when they need to be covered. Oh, excuse me. So now I'm going to talk about our different plan options that we have. We have 2 sort of umbrellas. We have our comprehensive plans, and our comprehensive plans are available for members who are under the age of 65. And these plans provide you a little bit of everything. We have higher prescription drug maximums because when you are under 65, as Caitlin mentioned, you are not eligible to join the Alberta Coverage for Seniors plan. So these plans have some higher prescription drug maximums. They have some dental care as well as our 92-day emergency travel coverage. And we also have our build your own plans. And our build your own plans are available for members of any age. You don't need to be 65 or over. You can be any age to join these plans. But these plans were built to work directly in tandem with the Alberta Coverage for Seniors plan. And I'll talk about that a little bit when I get to the build your own plans. But first, I'm going to talk about our comprehensive plans. So again, our comprehensive plans are available for members who are under the age of 65. We have 3 different levels of coverage, core health being the most basic, essential health, that middle of the road coverage, and enhanced health. Enhanced health has some higher prescription drug maximums, so more comprehensive than the other 2. All of our plans include single, couple, and family care coverage. And every single maximum in these plans are available per covered member. So each covered member receives these annual maximums. And with all of our plans, you're always able to move up in coverage, but once you've moved up in coverage, you're locked in for that 24 months before you can downgrade again. So maybe you're someone who you start with core health and you're meeting your annual maximums every year. You can move up to essential health, but once you've moved up, you are locked in for that 24 months. I'm going to go over a couple benefits within these plans, but just know that ARTA offers coverage for a long list of different benefits. So we have a long list of different medical aids and supplies, vision, hearing aids, CPAP machines. But I'm just going to, talk about a couple more popular benefits that people look for when looking at a benefits plan. So with our comprehensive plans, The overall coverage level is 100% unless otherwise indicated. So this means when you submit a claim to these plans, you'll be covered at 100%. And the overall annual maximum ranges from $10,000 in core health all the way up to $15,000 in enhanced health. Your prescription drugs are covered at 80%, ranging from $1,500 all the way up to $5,000 a year. You might not know how much money you've been spending on prescription drugs every year. So what I typically suggest to people is, if you're retiring and you're going to be losing your employer-sponsored benefits, maybe visit your pharmacist and ask them, hey, how much money have I been spending annually on prescription drugs? And they can kind of give you an average, and then you can make an educated guess on how much money you're going to need for prescription drugs in the year. ARTA also offers coverage for paramedical services. So paramedical services are those practitioners that offer massage, chiro, physio, occupational therapy. ARTA covers a list of 12 different practitioners. And our annual maximum for paramedical services is a little bit different from other plans. Ours is a combined annual maximum. So for example, if you had essential health, you have $1,000 a year to spread out throughout those practitioners. So maybe you're someone who really loves to get massages. You can spend that $1,000 a year on just massage if you want. We've done a little bit of research, and our members typically only use 1.8 of the paramedical practitioners. So we want our members to be able to use their annual maximums when they need it. Also, our diabetic supplies is a separate line item from prescription drugs. So if you're an insulin-dependent diabetic, you have $1,750 annually to use on those supplies. Our comprehensive plans also include our 92-day emergency travel coverage with no stability clauses for pre-existing conditions. And I'm going to go into our emergency travel coverage in depth in a couple slides here. You're also eligible under our comprehensive plans to receive our supplemental travel coverage. So if your trip is going to be longer than 92 days, you can use the supplemental travel coverage. Our comprehensive plans also include some dental care coverage. So you receive 80% coverage for those basic, preventative, or minor restorative dental work that you might need. So your x-rays, your cleanings, your fillings. Also, our enhanced health plans offers 50% coverage for major restorative work. So those lovely inlays and implants and crowns that you might need at the dentist. And maybe you have some dependent children at home that might still need some orthodontic work. Our enhanced health plan offers 50% coverage up to a $2,000 lifetime maximum. My son just got a spacer, so I know how expensive it can be for our dependent children to get orthodontic work. So maybe enhanced health is the best plan for you. So now I'm going to talk about our build your own plans. So our build your own plans were built to work directly in tandem with the Alberta Coverage for Seniors plan. So within our plans for our build your own plans, you're required to choose an annual prescription drug maximum of either $12,000 or $2,000. So at first glance, that might seem a little bit low, but with the Alberta Coverage for Seniors plan, they become the first payer of prescription drugs listed on the Alberta Drug Benefit List. And then ARTA becomes the second payer of prescription drugs listed on the Alberta Drug Benefit List. So that annual prescription drug maximum really stretches a long way. Also, ARTA covers a long, robust list of prescription drugs not listed on the Alberta Drug Benefit List, and we would pay those out at 80% under your Build Your Own plan. So our Build Your Own plans allow our members for some customization. We have two plans that do not include emergency travel coverage. Maybe you're someone who doesn't plan on traveling in retirement, so you can choose HealthWise or HealthWise Plus. And we have two plans that do include our emergency travel coverage, Total Health and Ultimate Health. So HealthWise Plus and Ultimate Health, on the second column here, These plans are our enhanced plans, so they offer some higher annual maximums for hearing aids, vision care, paramedical services, as well as offer some coverage for defined lifestyle medications, so hair loss, erectile dysfunction, or weight loss medications. Again, with our build your own plans, we offer coverage for a long list of benefits, so different medical aids and supplies, your paramedical services. Again, this is an annual combined maximum of either $1,200 a year or $1,400 a year if you went with one of the enhanced plans. These plans also offer single, couple, and family care coverage, and you're always able to move up in coverage. And once you moved up, you're locked in for that 24 months. So maybe you want to start with that $1,200 a year prescription drugs and something happens to you, you can move up to that 2,000 level, but you are locked in for that 24 months. And again, all the maximums are for every member that is covered. So now I'm going to talk about our emergency travel coverage. So if you're taking part in one of the plans that include emergency travel coverage, so any of our comprehensive plans or total health, or ultimate health, you're gaining access to some of the best emergency travel coverage in the marketplace because we do not have any stability clauses for pre-existing conditions. So if you have a change in medication or if you have a prior medical condition, you're not required to be stable for a period of time. So you're not required to be stable for 90 days. And if you go on your trip and something does happen to you, because of that pre-existing condition, you would be covered for it. Our emergency travel coverage requires that medical emergencies are considered sudden and unforeseen. So if you go to your doctor and they, prescribe you maybe a higher dosage in your medication or a lower dosage in your medication, and there's no cause for concern, both you and your doctor feel that you're well enough to travel, go travel on your trip, and if something were to happen to you because of that change in medication, you would be covered for it. You just need to ask yourself, what would a prudent person do? And if you're feeling well, go travel. We want our members to go travel when they're feeling well. So if you're unwell, go visit your doctor and they say, I suggest that you don't travel. We also offer trip cancellation and interruption insurance. So if you are unwell, or maybe your travel partner is unwell, or maybe your home suffers maybe a flood or fire and you cannot travel, you can cancel your trip up to $10,000 per insured person per incident. So with emergency travel coverage with ARTA, you can rest easy knowing that you have that trip cancellation and interruption insurance available to you. And if something does happen while you are outside of your province of residence, you are covered for 100% of eligible expenses, up to a $5 million lifetime maximum. At ARTA, no one's really come close to meeting that $5 million, so it's more than enough money for you to be covered when you do travel in your retirement. And you are covered for any 92-day trips you take outside of your province of residence. We know a lot of our members like to snowbird in places like Palm Springs or Phoenix, or they take, trips of a lifetime that are longer than 92 days. So we offer supplemental travel coverage in 15-day increments, all the way up to 212 days. And any unused 15-day increments that you don't use, you'll be reimbursed for that. It's always better to have your supplemental travel coverage before you go away on your trip. But if you are on a beach in Mexico and you're at day 90 and you have not made any claims in your emergency travel coverage, you can call ARTA and you can add that supplemental travel coverage. There is a cost to supplemental travel coverage. So what some of our members do is they go to Palm Springs and Phoenix, they find a cheap flight back to their province of residence, hold on to a coffee receipt at the airport, and they hop on another cheap flight back to the Sunshine, and that 92 days is an immediate reset. You're not required to be in your province of residence for a certain period of time. You can go back to the Sunshine and enjoy another 92 days. Again, there's no termination age in ARTA. When you are comparing different plans, make sure you are looking at that termination age. You can have your emergency travel coverage for as long as you want. I know I hope when I retire, I am traveling well into my 80s. and enjoying, you know, life as a traveling retiree. So all of our benefit plans also offer some really great additional resources. Green Shield Health is our partner for virtual physician services as well as member assistance program. We know how hard it is to get into your doctor if you do reside in Alberta. So this program is really great. You can connect with a Canadian licensed professional who can assist your situation online and prescribe you with some medication that you might need or provide you with some next steps. So this is really great for anyone who, you know, has a hard time getting into their doctor. It's online doctors that can help you when you're feeling ill and help prescribe you medication. They also offer a member assistance program, so our members receive 5 hours of free counseling, as well as 5 hours of free couples counseling. So we all know how important mental health is, especially over the past couple of years. So again, a really great program that ARTA offers their members. We also have a really great program, ARTA Cares. So ARTA Cares, you can call ARTA Cares, and it is a licensed nurse that will pick up the phone and will help you help navigate the healthcare system. We know how confusing it can be to navigate the healthcare system, so they can provide you advice for you know, getting a second opinion, or maybe you have a parent that you are taking care of that might need next steps to go maybe to a long-term care facility. They can help you answer those questions and support you on where to go to next. So we all know monthly premiums are always of interest for members when choosing a benefits plan. So if you want to know, you know, what's the most popular plan that ARTA members do have, Total Health with a $1,200 annual prescription drug maximum is one of our most popular plans. So here's an example of here is an example of the premiums, the monthly premiums that someone with Total Health would pay. So for a single, $122.75, couple, $240.25 monthly. And if you were to get dental care, the total monthly premium for a single with dental option A was $206.67, and dental for a couple is $404.17. And I'm going to go over the dental care in a bit here. But all of our monthly premiums are available on artabenefits.net. And the rate sheet that you guys would choose would be the public-private rate sheet. So everything is available on artabenefits.net. And again, I'll go through that in a bit. So with our build your own plans, dental care is not included. You can add a dental plan onto your plan if you want when you retire. You don't have to. About 80% of our members do have our dental care that are on a build your own plan. So we have 3 different options, option A, B, or C. Option A being the most comprehensive with 80% coverage for basic, preventative, and minor restorative work, as well as 50% coverage for major restorative work in option A. And option B does not include that major restorative work. And option C has 65% coverage for your basic, preventative, and minor restorative work. And again, with our dental care, we have single, couple, and family care plans. And you're always able to move up in coverage, but you are locked in for 24 months with our dental care plans as well. So at ARTA, we know how confusing it can be to choose a benefit plan. So we have a really great website, artabenefits.net. And there's a really great tool on artabenefits.net called Build Your Benefit Plan. So if you click on Build Your Benefits Plan, this tool will ask you a series of questions, whether you're over 65, under 65, whether you want travel, whether you want dental. And from the questions that you answered, a chart will populate with all of the plans available to you, as well as those monthly premiums. So then you can compare the different plans available to you and then choose a plan. And then on artabenefits.net, you're also able to apply online. It's a really easy application form. Also on ARTA Benefits plans, there's a lot of information. If you scroll to the bottom of the page and click on benefit booklets, that page will have all of our benefit plan booklets. and outline to you all of the different benefits that our plans do cover, as well as the rate sheets are available on artabenefits.net. So that's all I had for you today. I'll pass it back on to Caitlin. However, if you would like us to send you one of our enrollment kits, you can email join@arta.net and we will get one out to you today or tomorrow. And the enrollment kit has a plan options brochure, which outlines all of our plans, has a really great booklet on retirement as well as the rate sheet. So again, you can email join@arta.net. And if you have any questions, Amanda, Rosie, and I will stick around after the webinar and answer any questions that come in. So I'll pass it back to Caitlin.
Awesome. Thanks, Jennifer. So I guess we'll end things off by just saying thank you to all of you for taking the time to join us. We hope you found it informative. And as Jennifer mentioned, feel free to reach out to any of us with our cameras on for anything that you guys may need or any questions. We'll stick around for just a little bit longer for any additional questions. If you don't have any, again, appreciate the time and have a wonderful rest of the week. Rest of the day, and we'll chat soon. Thanks, everybody.